the hormone that is destroying your body without you knowing. There is a hormone in your body that, when present in excess, acts like a silent thief. It steals your energy, deforms your body, weakens your muscles, sabotages your sleep, and leaves you anxious and irritable all at the same time. This hormone is called cortisol, and the most frightening thing is that most people have no idea they are suffering from its effects. The content of this video is informational and does not replace the guidance of a doctor or qualified healthcare professional. The problem begins when cortisol exceeds healthy limits and remains elevated for long periods, causing progressive damage that can be mistaken for other conditions or simply ignored for years. In this video, you will learn the 12 visible signs that your cortisol may be elevated and what to do to regain control of your health. Get ready, because some of these signs will surprise you. The science behind the stress hormone. Cortisol is produced by the adrenal glands and is part of the hypothalamic-pituitary-adrenal axis, a system that regulates essential bodily functions. In the morning it rises to awaken the body, and throughout the day it gradually decreases, reaching its lowest levels at night to allow recovery. When functioning correctly, it keeps blood sugar stable, regulates the immune system, and controls blood pressure. The problem is that the modern lifestyle, with constant pressures, sleep deprivation, and poor nutrition, can completely disrupt this cycle. The chronic elevation of cortisol is a gradual and silent process that undermines health over months or years, and the first sign often appears in a place you look at every day without noticing. What cortisol is and why it matters so much. When the signs begin to appear, most people do not associate them with cortisol, treating each symptom in isolation without resolving the root cause. The effects of hypercortisolism are broad, affecting everything from physical appearance to mood and immunity. Recognizing these signs is the first step toward acting before the damage becomes more serious. Everything cortisol does in adequate doses, such as mobilizing energy, reducing inflammation, and maintaining alertness, begins to harm the body when done excessively and continuously. It is like a medicine that, at the wrong dose, becomes poison. The consequences appear in ways that frequently shock those who discover the origin of the problem. First sign: when your face starts to change for no apparent reason. One of the most classic signs of chronically elevated cortisol is the appearance of a rounded and swollen face, known as moon face. This happens because excess cortisol redirects fat to the face, neck, and upper trunk. The result is a visibly fuller face, with prominent cheeks and an altered facial contour, without any significant weight change. This sign is especially common in Cushing's syndrome and in people who use corticosteroids for prolonged periods. Everyday stress alone rarely causes this type of pronounced alteration. When it appears, it generally indicates a more serious and sustained elevation of the hormone. And there is a second equally revealing physical sign that appears right behind it. Second sign: the hump that nobody expects to find. Another sign recognized by doctors is the buffalo hump, an accumulation of fat at the base of the neck and in the upper back. Like moon face, it results from cortisol-induced fat redistribution and tends to appear in the most chronic cases. Many people mistake it for poor posture or aging, never imagining that the origin could be hormonal. In isolation, a small accumulation of fat on the back of the neck can have various causes. But when it appears alongside moon face, purple stretch marks, and muscle weakness, the clinical picture speaks for itself. The next sign appears on the skin in a way that cannot be ignored. Third sign: the marks that cortisol leaves on your skin. The stretch marks caused by excess cortisol are different from ordinary ones. They are wide, with a purplish or reddish-violet color, and appear mainly on the abdomen, flanks, and thighs. This happens because cortisol destroys the collagen in the skin, weakening its structure and leaving it unable to withstand tension without tearing. When a doctor identifies these purple stretch marks during a physical exam, they serve as an important clinical warning sign. Normal stretch marks generally evolve toward white or silver tones, while those associated with hypercortisolism maintain more vivid colorations for longer. There is yet another equally concerning skin sign. Fourth sign: when your skin becomes a map of bruises. An excessive tendency to bruise is another sign of hypercortisolism. Cortisol thins the skin and weakens blood vessels, making them vulnerable to minimal trauma. Small bumps that would normally leave no mark begin to produce large dark patches, especially on the arms and legs. What distinguishes these bruises from normal ones is the disproportion between the trauma and the injury. A simple touch or bump can result in extensive patches with slow healing. If you have been noticing that you bruise with unusual ease, this may be yet another sign of imbalance. The signs do not stop there. Fifth sign: the fat that no exercise can eliminate. Cortisol specifically promotes the accumulation of visceral fat, the kind deposited in the abdomen and around the internal organs. The result is a silhouette with a protruding abdomen and relatively thin limbs, a pattern that specialists recognize as clinically distinct. This fat is not merely an aesthetic concern. It is metabolically active and inflammatory, contributing to the development of type 2 diabetes, cardiovascular disease, and metabolic syndrome. Unlike common weight gain, this accumulation has a precise hormonal origin that makes it much harder to reverse without treating the root cause. The cycle that traps the body in storage mode. Excess visceral fat tends to further increase cortisol production, which in turn stimulates more accumulation in the same region, creating a vicious cycle that is difficult to break. Without treating the underlying hormonal imbalance, results at the gym are limited and frustrating. The person exercises, follows a diet, but the belly stubbornly refuses to shrink. This is not a lack of effort or discipline. It is pure biochemistry, and the body is simply following cortisol's orders. There is an even more concerning sign that affects not just appearance, but basic functional capacity. Sixth sign: when your muscles begin to disappear. Excess cortisol is profoundly catabolic. It stimulates the breakdown of tissues to obtain energy, and one of the first casualties is muscle. This process can lead to progressive weakness that primarily affects the thighs and arms, compromising simple daily activities such as climbing stairs or rising from a low chair without support. The sensation is one of weakness, not pain. The paradox of a body that gains fat and loses muscle at the same time. The result is the paradox of accumulating fat and losing muscle simultaneously, an unfavorable body composition that frustrates even those who train with dedication. The effort is there, but the internal hormonal environment sabotages the process of recovery and muscle building. Cortisol also invades moments of rest in a way that goes beyond ordinary tiredness. Seventh sign: the sleep that never comes and the rest that never arrives. Cortisol follows a circadian rhythm, high in the morning, low at night. It is precisely this drop that signals the brain to release melatonin. When cortisol remains elevated at night, that signal never arrives. Some people have difficulty falling asleep, others wake up several times or very early, and there are those who sleep enough hours, but wake up without energy, as if the sleep were not restorative. The trap of fatigue that never goes away. Poor sleep elevates cortisol, which impairs the following night's sleep, which raises cortisol even further. It is a downward spiral that can become established so gradually that the person does not notice when they cross the line between normal tiredness and chronic exhaustion. Sleep is the moment when the body regulates hormones, repairs tissues, and consolidates immunity. Depriving the body of this is depriving it of its main self-healing tool. Eighth sign: what happens to your hair and your skin? Excess cortisol can interrupt the hair growth cycle, forcing a greater number of strands to enter the shedding phase prematurely. The result is diffuse thinning, noticeable as a reduction in density and volume without creating completely bald areas. Unlike androgenetic alopecia, which has specific patterns, or alopecia areata, which creates patches, this hair loss is generalized and often reversible when hormonal levels normalize. Cosmetics and topical treatments may help superficially, but without addressing the hormonal cause, the problem tends to persist. Ninth sign: adult acne and the hidden role of cortisol. Cortisol stimulates androgenic hormones that activate the sebaceous glands, leading to oilier skin and the appearance of acne. even in adults who never had issues with pimples during adolescence. It is frustrating to treat this condition only with creams and topical antibiotics without realizing that the origin may be internal and hormonal. Just as treating a cough without investigating the underlying cause leads only to temporary results and frequent recurrences, attacking only the surface while the imbalance persists guarantees the same outcome. 10th sign: the pressure that rises and the immunity that falls. Cortisol raises blood pressure in two ways. It causes the kidneys to retain sodium, increasing the volume of circulating fluid, and it heightens the sensitivity of blood vessels to vasoconstrictive substances, raising vascular resistance. For many people, hypertension ends up being treated with antihypertensive medications without ever investigating the underlying hormonal cause. When cortisol is the culprit, blood pressure control may be insufficient or require ever-increasing doses over time, while the real problem remains unsolved. 11th sign: the body that gets sick more easily. Cortisol is naturally immunosuppressive, which has therapeutic value in autoimmune diseases and severe allergic reactions. But when the suppression is chronic, the body progressively loses its capacity for defense. Infections that once went unnoticed become recurrent, wounds take longer to heal, and the body seems to always be one step behind in the battle against viruses and bacteria. Frequent colds, recurring infections, and recurrent cold sores can all be signs that the immune system is chronically compromised. 12th sign: when the mind also pays the price. Cortisol has profound effects on the central nervous system, especially on the hippocampus and prefrontal cortex, regions responsible for emotional regulation and decision-making. The chronic excess of this hormone alters the production and sensitivity of neurotransmitters such as serotonin and dopamine, resulting in heightened anxiety, irritability, disproportionate to minor setbacks, and a constant state of alertness that prevents relaxation. But there is an equally disturbing opposite extreme: emotional numbness, a feeling of apathy as if nothing could provoke any genuine reaction anymore. The thin line between anxiety and hormonal imbalance. This condition can be confused with depression or generalized anxiety disorder. The risk is treating only the emotional symptoms without investigating the hormonal cause, prescribing medications while cortisol continues to cause damage. This does not mean that all anxiety has a hormonal origin, but ignoring this possibility can unnecessarily prolong suffering. Knowing the signs is the first step. Understanding the causes is the second. The causes few people know about. The most serious and least frequent cause is Cushing's syndrome, in which a tumor in the pituitary gland or adrenal glands causes the body to produce cortisol uncontrollably. Although rare, it is a serious condition that generally requires imaging exams, specific hormonal tests, and in many cases, surgical intervention. The most common cause of medicinal hypercortisolism is the prolonged use of corticosteroids, such as prednisone, dexamethasone, and hydrocortisone, widely prescribed for rheumatoid arthritis, asthma, inflammatory bowel disease, and other conditions requiring immune system suppression. When used for long periods, they can reproduce all the physical signs of Cushing's syndrome. What happens when the medicine becomes the cause? Those who use corticosteroids for long periods need close medical supervision. Abrupt discontinuation can be dangerous. The adrenal glands may have temporarily reduced their natural production, leading to secondary adrenal insufficiency. For this reason, the reduction of these medications must always be gradual and supervised. There is also a type of elevation much closer to our daily lives. Everyday stress and its hidden cost. The physiological elevation of cortisol occurs in response to chronic everyday stress, workplace pressure, financial problems, relationship conflicts, sleep deprivation, and excessive exercise without adequate recovery. In the short term, this elevation is an adaptive and healthy response, cortisol fulfilling exactly the function it was designed for. The problem arises when the stressor never disappears and cortisol remains chronically elevated even without any diagnosable disease, producing the same damage over time, though generally in a less intense form than in serious clinical cases. What pseudo-Cushing is and why it fools even doctors. In pseudo-Cushing, cortisol levels are elevated secondarily to other problems such as severe alcoholism, major depression, severe obesity, and uncontrolled diabetes. The difference is that when the underlying condition is treated, cortisol tends to return to normal without direct hormonal intervention. The similarity to true Cushing's syndrome can lead to mistaken diagnoses, which makes a complete clinical investigation indispensable. How to distinguish a serious sign from an exaggeration. A swollen face in the morning is far more frequently caused by excess salt, poor sleep quality, or an inadequate sleeping position than by hypercortisolism. Hair loss has dozens of possible causes: iron deficiency, vitamin D deficiency, thyroid dysfunction, hormonal changes. Adult acne can result from inflammatory diet or comedogenic cosmetics. The isolated presence of one or two signs rarely justifies an investigation for Cushing's syndrome. When the signs come together, and the alarm should sound. The signs that truly motivate investigation are those that appear together, especially the more specific ones: wide purple stretch marks, moon face, buffalo hump, proximal muscle weakness, and hypertension without apparent cause in young people. The more specific signs appear simultaneously, the greater the justification for seeking specialist evaluation, not as a source of panic, but as a responsibility toward one's own health. When and how to investigate cortisol. The investigation begins with a consultation with an endocrinologist, taking into account the complete clinical history, medication use, and detailed physical examination. The main tests used are the 24-hour urinary free cortisol measurement, which measures the total hormone production over an entire day, the nighttime salivary cortisol measurement, which checks whether cortisol drops adequately at night as it should, and the dexamethasone suppression test, in which a small dose of this medication is administered and the response is evaluated to see if cortisol suppresses adequately. Together, these tests form a precise and well-established picture for diagnosis. Why you should not interpret the tests on your own. Reference values vary according to the laboratory, the method, and the time of collection. A result that is altered in only one test is not sufficient to make a diagnosis. Buying tests online and attempting self-diagnosis can lead to mistaken conclusions in either direction. A complete evaluation carried out by a qualified professional is irreplaceable. In the meantime, there are measures you can take today. The power of sleep in regulating cortisol. Improving sleep quality is the change that most impacts cortisol levels. During deep sleep, the body carries out essential processes of recovery and hormonal regulation. Depriving the body of adequate sleep is one of the most direct ways of keeping cortisol chronically elevated. Establishing a fixed time to sleep and wake up, even on weekends, is one of the most powerful habits for regulating the circadian rhythm and consequently the cortisol pattern. The goal recommended by specialists is 7 to 9 hours per night for adults, and not only in quantity, but also in quality. The invisible enemy that steals your sleep every night. The blue light from screens suppresses melatonin and keeps the brain on alert, raising cortisol precisely when it should be falling. A technology disconnection routine of at least 1 hour before bed is simple and highly effective. Room temperature, noise level, and mattress quality also directly influence sleep. For those struggling with elevated cortisol, every night of good sleep is a small accumulated hormonal victory. Nutrition as a tool for hormonal control. The relationship between nutrition and cortisol is deeper than many people imagine. Cortisol is closely linked to blood sugar regulation, and sharp fluctuations in blood glucose are an important trigger for its release. When you skip meals, blood sugar drops abruptly, and the body responds by releasing cortisol to mobilize energy reserves and normalize blood glucose. This cycle, repeated throughout the day, keeps cortisol at unnecessarily high levels. Meals composed of quality proteins, Healthy fats such as olive oil, avocado, and nuts, and low glycemic index carbohydrates, such as legumes, vegetables, and whole grains, release energy gradually and sustainably, avoiding these harmful fluctuations. What caffeine has to do with all of this? Excessive doses of caffeine can temporarily raise cortisol. For people with functional hypercortisolism, reducing consumption, especially in the afternoon and evening, can be a relevant step toward improving both cortisol and sleep. There is no magic food that cures hypercortisolism, but there is a dietary pattern that systematically nourishes hormonal balance or sabotages it. Mental rest and the nervous system that needs to breathe. The autonomic nervous system has two main modes: the sympathetic, activated in situations of stress and emergency, and the parasympathetic, which comes into action during moments of relaxation and recovery. The problem with modern life is that we spend much of our time in sympathetic mode with elevated cortisol and rarely give the body enough time to enter parasympathetic mode. Techniques such as deep diaphragmatic breathing, meditation, gentle yoga, tai chi, and simply spending time in calm, natural environments are effective ways to activate the parasympathetic system and signal to the body that it is safe, which in turn reduces cortisol production. Even 5 to 10 minutes of conscious breathing per day can produce measurable changes in hormone levels over time. Exercise, supplementation, and the balance that makes the difference. Moderate and regular physical activity is one of the best ways to reduce stress and normalize cortisol. However, high-intensity exercise without adequate recovery between sessions can, paradoxically, keep cortisol elevated. Combining more intense training sessions with light walking, mobility work, and stretching allows you to reap the benefits of exercise without overloading the stress axis. Ashwagandha, an adaptogenic root with centuries of use in Ayurvedic medicine and promising clinical studies for reducing cortisol and the perception of stress, can be a useful complement within a broader approach, always used with appropriate professional guidance. Cortisol is not your enemy. Cortisol is not a villain. It is an essential hormone, whose absence can also be fatal, as occurs in Addison's disease, a rare condition in which the adrenal glands do not produce enough cortisol. The goal is not to eliminate it, but to keep it within a rhythm and at levels that serve the body without harming it. The central message is that hypercortisolism, whether in its more serious pathological form or in its functional expression related to lifestyle, is a measurable, diagnosable, and treatable condition. It is not something you simply need to accept as an inevitable part of modern life. With the right strategies and adequate medical follow-up when necessary, it is possible to restore hormonal balance and, with it, quality of life. The decision that can change the course of your health. If you have identified multiple signs described in this video, especially the more specific ones such as wide purple stretch marks, progressive muscle weakness, and changes in body fat distribution, do not delay consulting a doctor. These signs deserve proper attention and investigation. Information is power only when combined with action. Your body is constantly sending signals. Some whispers, others shouts. Learning to hear them, interpret them correctly, and act based on them is one of the greatest gifts you can give yourself. Elevated cortisol may be silently shaping your body and your mind right now. The question is, will you wait for it to shout, or will you listen while it is still whispering?